Hi, Dr. Ramya. You're on mute, Dr. Ramya.
I'm actually trying to set up the background. Just give me
Yeah,
a
so
second.
sure,
Yeah,
sure.
please tell me.
So I just shared, how you can set that up, Dr. Ramya. So
On WhatsApp?
on WhatsApp, yes.
I'm using my phone actually.
Uh, okay. Okay. So in phone, from phone also, you'll have to download the file and save it to your files. And then
Yeah.
from there,
Is it from files or I can do it from images also?
I sent you an image on WhatsApp. So download that
Yeah, I did.
into your file. So if it is saved in your photos, then you
Yeah.
can go to the Google Meet window, click on the three vertical bars that are there.
Vertical bars. Okay.
Yeah, and there you see apply visual effects.
Yeah, never mind. I think they will be back in a minute or two.
Yeah, I think so. Pratik, who all are the host? You, me, doctor.
Yeah, and then the admin. When possible.
Yeah, I think it was ended by mistake by someone.
Yeah,
Hello.
yes.
Yeah, hi, Dr. Rahul.
Yes, doctor.
Again, I'm just trying to save this background. So you told me to go to the three vertical bars, even the three dots.
Right. And go to apply visual
Settings.
effects. Apply visual effects. I'll just guide you through. I'll do it
No,
myself
there is
as well.
actually activities, add others, in call messages, take notes, on the go, share screen, show captions, report a
Yeah.
problem. Yeah, that's all. There
Or
is
else
no visual
Yeah. Just
effects.
we can just let it be. I think we can just begin like this. I don't think the background is such of that importance, right?
Okay. Is my background okay? Is it decent?
Yeah, yeah. It's all good. Yes. No, I think so. Dr. Rahul, we can start, right? I think what is more important, doctor, is to hear you than the background, because
Sure.
so I will formally start this session, right? Good morning, everyone. My name is Pratik. I'm co-founder of Insurance. Am I audible, everyone?
Yeah, Pratik, you are.
Okay. No, so I think there has been some issue with the connections, but we will start it right away. Dr. Ramya is here. I think there is any issue.
No,
Yeah,
no.
yeah.
Actually, I'm online. I think the host has disconnected it, so I'm there. I'm available. So I think we can start, sir.
Sure. No,
Yeah.
so I think today we have a very important, relevant topic, and it's a great honor to have Dr. Ramya, who is a leading oncologist surgeon at KIMS Hyderabad. So, as I always say, Dr. Rahul, Dr. Ramya, I'm the odd one out here because I'm not a doctor. So, Dr. Rahul will moderate the session because he is more fit to ask me the right questions so that it's beneficial to all of us. Just to give you a little background about the audience, so they're majorly Hindi speaking as well, right? So if we can have the session mix of Hindi and English, it would be great. But I leave it on you. So over to you guys, Dr. Rahul.
Thank you.
Yeah. Thanks, Pratik. And welcome everyone, and especially Dr. Ramya. Thanks a lot for agreeing to be a part of
Thank you,
our
sir.
of this platform, and on a Sunday taking the time out. For benefit of everyone, Dr. Ramya is quite an illustrious, breast cancer and endocrine cancer surgeon, and she has vast experience, worked at quite reputed and esteemed institutes, including SDPGI, AIMS in Delhi, and is now associated with KIMS in Hyderabad. So we are very fortunate to have her here with us this Sunday. And the intent, Dr. Ramya, is to see that how we, talk about this cancer, some, importance of screening, vaccination. And then the key is that all these people who are from a non-medical background, how can we help them break some myths and, try to reduce the suffering or the burden or the impact that sometimes cancer has, not only on the individual, but I think it's the whole family which gets impacted. I think it's a
Yes.
very relevant topic, and we look forward to getting some key insights from you. So I think to start with, Dr. Ramya, I would request if you can give an overall view of cancer and how it is increasing. Perception is that probably it's a disease of the West, but in India, what do you see, how the incidence or prevalence is increasing? We can start from there. Yeah.
Yeah. Thank you very much for that kind introduction, sir. I'm really glad to be a part of this. Yeah, it's always a privilege to get to talk to a group of people about cancers, especially the forte that I deal with, that is breast and endocrine cancers. But to answer your question overall, so what is a cancer? We know that our body is made up of tissues are made up of cells, right? So cells have genetic material, which is DNA, and if something goes wrong, it is called as a mutation. If this mutation gives the cell to grow uncontrollably, that it just goes out of control and starts growing, not only that it grows uncontrollably, it then acquires the capacity to dislodge, go somewhere else, grow over there, use that particular area's blood supply and nutrients, and then take over that particular organ. You know, all these capacities make a normal cell into a cancer cell. So this is one genetic change or a group of genetic changes that can happen that makes a cell into a cancer cell. So the cancer numbers are definitely increasing according to the that is global cancer data that comes out every 4 years. The projected, the estimates of cancers are the risk for development of cancer is 1 in 4 to 1 in 8 in the coming future. Especially for breast, the numbers have reached very high levels. Even in India, I mean, there is actually a myth that cancer is only a disease of the West. So maybe a couple of decades back, it was true because we're slowly adopting whatever those factors which were causing. Why should there be a difference? That why should West have more cancers? Why not India? Because we had certain lifestyle choices which led to that we were doing at that time, and we have westernized, we have adopted those lifestyle changes. So slowly we are also becoming into west. So it's not about geography, it's not about culture, it's about the current lifestyle choices that we make. So the more sedentary that we are, the kind of foods that we eat, the smoking, the alcoholism, all these we have adopted we have westernized. So our diseases have also westernized. So it's a total myth now that cancers happen only in the West. It is, we are actually in denial that we are consuming a lot of Western things than we actually know about. So yes, the number of cancers have definitely increased. Even so, especially the breast cancers, and the spectrum has changed from the infective causes to lifestyle causes. So it's very important to recognize that fact. Um, a lifestyle increases or changes the chance of acquiring certain mutations which make it develop into cancer. So we are actually exposing our body to a lot of insults which increase its chance to develop certain mutations which sustain themselves into a cancer. So that's what I wanted to say.
No, thanks, Dr. Ramya. So I think some 2 or 3 key points from what you just said. That see, the incidence in India is also increasing, and primarily because of the change in our lifestyle. Right, we seem to be copying the West a lot. And the second, and I think just to explain to everyone what mutation means, it's if some of you use your phones or laptops and you're aware. So it's just like the operating system. There is some defect that happens and you're not able to run some program. So it's just like, a kind of virus that happens inside your software, because of which now the body is not able to function in that particular organ properly, and it starts propagating. And I think this is a very nice segue, Dr. Ramya, to our next question, which is like, I'm too busy, right? Our urban lifestyle, if we see, right? And I'm too busy in, my day-to-day work. And why should I go for screening? So I think it would be great if you can then now tell us, how we can, and what is the importance of screening of cancer for cancer? Yeah, especially in some age groups. And if you can elaborate a bit of risk factors for some of the most common cancers, for which it becomes important for us to definitely get a screening for.
So your first statement that we are too busy to get screening done, I think that's a very unhealthy way of looking at our life, our health. Because where there is a will, there is a way. And if we don't know our priorities, if we don't prioritize our health at the right time, we will be forced to prioritize our diseases, right? So especially when we talk for cancers, there are certain cancers that are more common in men and more common in women. If we talk about men, the most common cancer is lung cancer. The most common reason why it happens is active and passive smoking and the pollution, right? And apart from that, in India, we have among men the oral cancers, which are caused by tobacco products. Again, everything is related to tobacco products and smoking. And among women in India, until a decade back, it used to be the cervical cancer that was the most common cancer. It is caused by human papilloma virus, whereas now breast cancer numbers have taken over, and breast cancer is the most common cancer among women, including India and across the world. And if we take the total number of breast cancers, the number of breast cancer exceeds any other cancer. So if we put together all cancers among men and women, the number of new breast cancers that we are diagnosing exceeds far more when all those are put together. That is the burden of breast cancer. It is the burden of practices, and by being so what a screening, there are a lot of we talk a lot about cancers which are more common, right? So certain cancer are very rare. For example, adrenal cancer is so rare, we don't keep screening for it. Screening means you actively go and look for those symptoms or signs when still we don't have any symptoms. So, for example, the screening choice should depend upon what is the common cancer. For example, in Japan, they have screening for thyroid cancers, papillary thyroid cancers, because of the nuclear fallout that happened a few decades back. Still, they have more and more thyroid cancers because of the radiation. So it makes sense to screen for thyroid cancers, but for us Indians, it doesn't make sense. So for us, the screening makes sense to identify breast cancers, cervical cancers among women, and ovarian cancers to a certain extent. And about the men, the lung cancers, the oral cancers, and overall for both men and women, colon cancers. And for North Indians, the gallbladder issues, and for South Indians, the stomach issues, all these kinds. So the screening should be prioritized to that particular region and how the incidence in that particular area is. But we all must take time out to undergo screening at the right time. For each cancer, it is different when you should start screening and what is your screening protocol, because it depends upon your risk factors and at what age the, for example, if you have a family history then of breast cancer, then the age at screening that you need to undergo is different versus to a lady who doesn't have family history. Suppose you have poor lifestyle choices, then you are at more prone, you are more at risk to develop cancer. So you need screening a little more intensively. So, generally speaking, for breast cancer, the screening should start at the age of 40 by screening mammography. But there are other modes of screening like the ultrasound scan and the self breast examination, which is also a kind of screening. Self breast examination should start at the age of 18, and ultrasound can be done before 40. Suppose this is for an average risk individual. For cervical cancer, your screening for pap smear can start from 30-35 years. And most importantly, it is important to take cervical cancer, the HPV vaccine, human papillomavirus vaccine, because it can protect us from these infections which can cause cervical cancer. And for lung cancer, again, your screening should start somewhere around 40. And a non-contrast HRCT can help in identifying any at-risk, high-risk lung lesions. And oral cancers, yes, of course, you can meet a head and neck surgeon or an ENT surgeon to, get your oral cavity examined, especially if you are someone who's at risk factors like chewing tobacco, at gutka, all these kind of things. So, screening definitely, you should meet your doctor, your oncologist to understand what should be the ideal screening protocol for you and for what all cancers that you need to get screened. So, it is practically impossible to screen everyone for everything.
Right.
So we need to choose. You should meet the oncologist, and then they can, depending on your history, or if you have some genetic history, depending on that, your individualized screening protocol can be kept in place.
Okay. No, thanks, Dr. Ramya. So I think some very important nuggets of wisdom you've just shared, right? I did not know, like, by region, you need to specifically also screen for cancers. Like in North, you should screen for gallbladder, in South for stomach, right? I think that this is very important, right, in India. And then for men and women, of course, different, cancers. And just to confirm, Dr. Ramya, you mentioned that if you have a family history for breast cancer, you should start screening at what age?
So the guidelines say that you should start screening at least 10 years ahead of the youngest member who's affected with breast cancer. For example, a lady is affected at 40, her daughter should be started screening at least at the age of 30, if not 25, at least 30.
Okay. I think that's very important. And
Yes.
then, in case they do not have that history, then what is the age? Usual age is 40 years for
So
mammography.
for average risk individuals for breast cancer, it is around, we should start screening by mammography at the age of 40.
Okay.
But these guidelines have been formed again a few years back. And sitting at Kim's Hospital's Kondapur, the average age of ladies that I treat with breast cancer is 35. So I will not be serving the society if I advise them to start screening from the age of 40.
Right.
So I think it is going to take time for the guidelines to include all these things, because guidelines are for the entire world.
Mhm.
So more and more in India, we are seeing young women with breast cancers, And maybe I sit around in such areas who have high lifestyle implications. Like most of them are software professionals. They have access to highly processed food. They are sedentary. They don't exercise. I don't know. I mean, I can go on, but for whatever reasons, the average age that I see women with breast cancer is 35. I mean, every other week I see women who are in 20s with breast cancer. I'm not kidding. I just last week I've seen a lady with a very weird presentation. She's around 26, and even the I just operated a lady who is around 29 last week. So it's not uncommon that we see young women also with breast cancer. So if I just blindly say that just start screening at the age of 40, before that you need not do anything, it's wrong. But by mammography, we can start screening at least at the age of 40, because mammography helps in them. And before that, we can use ultrasound both breasts and self breast examination. That is, one can examine their own breasts, or come to us oncologists for clinical breast examination if needed, a screening ultrasound. So these are very easily available tests, not painful, no radiation risk. And they can detect a lot of things ahead of time.
Right, great. So, Dr. Ramya, I'll just summarize in Hindi for the audience. तो दो तीन चीजें जो की हैं, सबसे पहले कि जो ब्रेस्ट कैंसर है उसकी तादाद बाकी सब कैंसर्स को मिला के भी ब्रेस्ट कैंसर की तादाद ज्यादा है, राइट? ये पहला पॉइंट है। तो सबसे इंपॉर्टेंट ये है कि हम इस पे फोकस करें, और इसमें स्क्रीनिंग का बहुत बड़ा महत्व है। और स्क्रीनिंग की एज, अगर आपकी फैमिली में क्लोज फर्स्ट डिग्री रिलेटिव्स में, अगर आपको या ब्लड रिलेटिव्स में जहाँ पे आपका खून का रिश्ता है, उसमें अगर किसी लेडी को ब्रेस्ट कैंसर हुआ है, तो जिस एज पे वो हुआ उसे 10 साल पहले कम से कम आप अपनी स्क्रीनिंग शुरू कर दें। और अगर नहीं है ऐसी हिस्ट्री, तो भी 35 प्लस ईयर्स, 35 साल की उम्र के बाद मेमोग्राफी एडवाइस्ड है, और उससे पहले
40 साल के बाद मेमोग्राफी एडवाइस्ड है। उसके पहले अगर आपकी कोई फैमिली हिस्ट्री हो, या आपको लगता है कि यू वांट टू बी एक्टिव, आपको लगता है कि एक्टिवली आपको देखने का इच्छा है कि इफ यू हैव एनी रिस्क फॉर ब्रेस्ट कैंसर, आप अल्ट्रासाउंड स्कैन करा सकते हैं। क्योंकि मेमोग्राफी 40 साल के बाद जो ब्रेस्ट की स्ट्रक्चर है उसमें कैंसर को दिखाने का ज्यादा चांसेस है, बट उसके पहले मेमोग्राफी करने से भी कोई फायदा नहीं। अगर आपको 40 साल के पहले स्क्रीनिंग कराना है किसी भी वजह से, तो आपको अल्ट्रासाउंड स्कैन की यूज इट कैन हेल्प।
ठीक है, आई थिंक डॉक्टर रमन, दिस इज वेरी, ये बहुत ही इंपॉर्टेंट पॉइंट है, क्योंकि हमारे जो क्लाइंट्स भी रहते हैं वो मिक्स रहते हैं, वो यंग पॉपुलेशन भी है, जो इंडिविजुअल्स हैं, और कॉर्पोरेट्स में स्पेशली। ठीक है, हम कई बार देखते हैं कि सिर्फ वो एक पैकेज में 40 प्लस लिखा होता है, लेकिन उनकी एवरेज 28-29 साल होती है जो वर्क फोर्स की है। तो उसमें हम ये एक अल्ट्रासाउंड मेमोग्राफी एक ऑप्शन उनको दे सकते हैं। जैसे आपने बताया कि किम्स में एक अर्बन एरिया में आप देख रहे हैं कि यंगर एंड यंगर पॉपुलेशन जो है, और वो ब्रेस्ट कैंसर के साथ इफेक्टेड होके आ रहे हैं। तो ये एक ऑप्शन इंपॉर्टेंट है जो कि हम दे सकते हैं, और इसके बारे में हम अपने कॉर्पोरेट्स को और जो यूथ है उनको एडुकेट कर सकते हैं। कि क्योंकि एक चीज जो बड़ी रहती है लोगों में कि मेमोग्राफी इज एन एक्सरे एक्सपोजर, राइट? पर उसके साथ आपने बताया कि 40 साल से पहले मेमोग्राफी का कोई इंपॉर्टेंस भी नहीं है, क्योंकि वो इतनी सेंसिटिव या स्पेसिफिक नहीं होगी, उसका फायदा नहीं है, क्योंकि बिकॉज ऑफ द स्ट्रक्चर ऑफ द ब्रेस्ट, राइट?
तो 40 साल के पहले ग्लैंड की थिकनेस होती है, so glandular डेंसिटी ज्यादा होता है। तो मेमोग्राफी इज अ 2D इमेज ऑफ ओवरलैपिंग इमेज, तो उसमें ज्यादा कुछ दिखेगा नहीं। अगर किसी को ऑलरेडी एक लंप है, उनमें हम मेमोग्राफी जरूर करते हैं फॉर डॉक्यूमेंटेशन। आपने सही पॉइंट उठाया कि मेमोग्राफी का जो रेडिएशन है, तो इसके बारे में बहुत लोगों को मिथ है कि मेमोग्राफी की रेडिएशन से भी हमको कैंसर हो सकती है। तो फर्स्ट ऑफ ऑल, हम जो भी हमारे शरीर को देते हैं या टेस्ट कराते हैं, इन्वेजिव टेस्ट या नॉन इन्वेजिव टेस्ट, फॉर एग्जांपल हम पैरासिटामोल लेते हैं तो उससे एसिडिटी हो सकता है। एसिडिटी के लिए पैंटॉप लेते हैं तो उससे ब्लोटिंग हो सकता है। तो आप किसी चीज को, बॉडी को एक्सपोज करते हो तो उससे एक फायदा होती है, एक हल्का सा नुकसान भी हो सकती है। सिमिलरली जब हम मेमोग्राफी करते हैं हर साल, अगर हम 10,000 मैमोग्राफीज करते हैं, उनमें से करीबन हमको 800 to 900 ब्रेस्ट कैंसर देखने को मिलते हैं. बट उतना क्यूमुलेटिव रेडिएशन से 1 या 2 लोगों को ब्रेस्ट कैंसर हो सकते हैं. It is called as attributable risk. This is just a statistical model. तो the benefits बहुत ज्यादा होते हैं versus the risk. So वैसे ही हम मैमोग्राफी को देखना चाहिए. एंड मैमोग्राफी से कोई डरने वाली चीज नहीं है. ऑफ कोर्स अगर 40 साल के पहले है तो अल्ट्रासाउंड जरूर हेल्प करता है.
Thank you. So, Dr. Ramya, let's now move to mention about cervical cancer as well in women, right? And then we'll come to other types. तो वैक्सीनेशन जो है, इसके बारे में आप कुछ बताएंगे और इसकी कुछ myths और इसकी गाइडलाइंस, राइट? बिकॉज आज की डेट में भी वैक्सीनेशन की पेनिट्रेशन जो है और कितने लोगों ने ली है वो बहुत तादाद उनकी कम है. So what would be your suggestions and guidelines? First, a general awareness, why it is important and for what reasons, and then guidelines around getting that vaccination.
So for vaccination, especially we're talking about the cervical cancer, which is caused by the human papillomavirus, right? So human papillomavirus not only causes cervical cancer, it can cause the vulval cancer, it can cause penile cancer in men, and it can cause certain other cancers in both men and women, right? So certain anal malignancies. So the idea is to protect the body against such load of this human it's a very highly prevalent virus. So it can get transmitted from one person to the other during sexual intercourse, right? During close contact. So the idea is to have such antibody levels in our body which prevent such high infections, load of infections within a person. तो हर वैक्सीनेशन का ये मकसद होता है कि हम बॉडी को तैयार रखे with antibodies so that when there is an attack, our body fights effectively and prevents such major infection, right? So especially for viral vaccines, we take a protein which is highly antigenic, means we identify a protein or an antigen from that virus जिसको हमारी immune system इतना strongly recognize करके उसके against antibodies तैयार करके रखती है. So our body's immune system, first response is IgG, then there are some IgM antibodies which are in certain low level. The second infection, when it happens, our body attacks in full force. It doesn't even let that virus stick. That kind of capacity our immune system has. There are phases of response. So now our idea is to give our body the chance of having that phase 2 response where it can attack the virus in full swing by exposing our body to this low level of inactivated proteins from the virus, right? Am I too technical? But
no, I think
yeah,
Dr. Ramya, I'll explain and simplify it, right? But I think the key आपने समझाया कि ये एक जो वायरस की इन्फेक्शन के कारण कैंसर होता है, और जैसे हम सिंपल सी भाषा में हम अपने बच्चों को पोलियो के ड्रॉप्स पिलाते हैं, बीसीजी वैक्सीन दिलवाते हैं, डीपीटी वैक्सीन दिलवाते हैं ताकि ये इन्फेक्शंस ना हो, क्योंकि ये वायरस कैंसर इन डिफरेंट कैंसर्स की कॉज में है, तो इसके लिए भी एक वैक्सीन है. तो जैसे हमने पोलियो की वैक्सीन ली ताकि हमें पोलियो ना हो, हम अपने बच्चों को देते हैं. हम बीसीजी वैक्सीन देते हैं, हम डीपीटी वैक्सीन देते हैं, न्यूमोनिया की वैक्सीन देते हैं, इन्फ्लुएंजा की वैक्सीन, फ्लू की वैक्सीन देते हैं ताकि हमें वो डिजीज ना हो. इसी तरह ये जो कैंसर्स हैं, ये जो इस वायरस से होते हैं, अगर इस वायरस की हम वैक्सीन लेंगे तो हमें इन कैंसर से प्रोटेक्शन मिलेगी.
करेक्ट. So the protection, the level of protection that one gets depends upon the effectiveness of vaccine. तो वैक्सीन तब इफेक्टिव होगा जब आप अनएक्सपोज्ड हो, आपका पहला एक्सपोजर वैक्सीन से हो. तो हम सेक्सुअली एक्टिव होने से पहले अगर इस वैक्सीन को लेते हैं, क्योंकि हमको पता है कि द मोस्ट इम्पोर्टेंट वे, जैसे वो हमको सेक्सुअल कांटेक्ट से या क्लोज कांटेक्ट से स्प्रेड होती है, उसके पहले हमारा वैक्सीनेशन शेड्यूल पूरी हो तो उसकी इफेक्टिवनेस बढ़ती है.
Right.
So anything is not 100%. Everything is, the effectiveness is around 80 to 90%.
ठीक है
on preventing the infection with HPV virus. ठीक है?
ठीक है
So for it to be effective, all the children should be vaccinated between the ages 9 to 15.
ओके
Especially the girls. Even boys can take it. So उसके बाद अगर 15 के बाद लिया जाता है, 15 9 to 15 years में दो डोसेस होते हैं. एक 0 month पे, मतलब when you take it for the first time, then 6 months पे.
ठीक है
उसके बाद we assume that the person is maybe sexually active. We don't know. So अगर कोई sexually active हो ना हो, after 15 the schedule is 0, 1 and 6. 3 doses. 0 month पे, 1st month पे, 6 months पे.
ठीक है
Right? So but यहाँ पे ये चीज समझने की जरूरी है कि effectiveness कम हो जाता है after you cross certain age, because already you may be having exposure to that virus through many because of various reasons, right? But I think the current generation 40s and 50s did not have, उनको वो मौका ही नहीं था वैक्सीन
Right.
लेने का. तो it's okay if you take it before 45. So if suppose you haven't taken it, उसके बाद अगर नहीं भी लिया हो तो पैप स्मीयर रेगुलरली करा के एचपीवी इन्फेक्शन है कि नहीं है, अगर कोई प्री कैंसरस चेंज है नहीं है, ये सब हम जान सकते हैं. तो निराश होने की कोई जरूरत नहीं है, बिकॉज अगर वैक्सीन लेने का आपको मौका नहीं मिला हुआ हो तो आप पैप स्मीयर करा के उसको आइडेंटिफाई कर सकते हैं.
थैंक्स डॉक्टर रम्या, ये बहुत बहुत इम्पोर्टेंट चीज है. इसमें एक और पॉइंट मैं क्लैरिफाई चाहूंगा, आपको रिक्वेस्ट करूंगा आप क्लैरिफाई कीजिए कि आज तक जो धारणा रही है कि एचपीवी वैक्सीन इज ओनली फॉर फीमेल्स, आपने बोला कि ये यंग बॉयज कैन आल्सो टेक इट, तो इसके बारे में अगर आप थोड़ा सा हमें गाइड करेंगे तो आई थिंक इट विल हेल्प ऑल ऑफ अस.
सो पहले ऐसा शुरू हुआ था कि सर्वाइकल कैंसर वाज द मोस्ट कॉमन कैंसर, राइट? वी जस्ट हर्ड दैट. तो शुरुआत इसीलिए हुई थी क्योंकि वी वर डेस्परेट टू कंट्रोल इट. बट पिनाइल कैंसर इतना कॉमन नहीं है, एनल कैंसर इतना कॉमन नहीं है, बट दे आल्सो कैन बी प्रिवेंटेड विथ एचपीवी वैक्सीन. तो शेड्यूल में आने के इट इज डिफरेंट हाउ गवर्नमेंट डिसाइड्स टू पुट थिंग्स इनटू शेड्यूल, एंड उसको हाईलाइट किया गया था कि गर्ल्स शुड टेक टू प्रिवेंट सर्वाइकल कैंसर, राइट? But over time, that now that has been accepted, we now are also highlighting that it will help men, right? So that is the reason why. पहले क्यों ऐसा था, अभी ऐसा क्यों है? क्योंकि on a larger level, government and health bodies को वो priority थी कि लड़कियों के health में उसको ज्यादा popular करें, because that was the priority. But yes, it was proven prior, and it is now proven effective that not to the extent of cervical cancer, yes, it can prevent the penile and anal malignancies, because as such the numbers are not so high. वो लड़कों को भी हम दे सकते हैं, and effectiveness is slightly debatable in preventing penile and anal malignancies.
Great, thank you. So Dr. Ramya, I'll just summarize this for our audience. First point is that HPV vaccine should be given before let us say you get into sexual activities, right? So
I think better to say 9 to 15 years.
9 to 15 years. Okay. 9 to 15 years. And of course, to all, women, all girl childs, but men can also, boys can also take it. Right. So thanks for that. Now, Dr. Ramya, I'll move to another very important topic about the advances in screening. Right. And in that, and you mentioned about ultrasound screening for, breast cancer. So any other advancements that are there for cancer markers or any other techniques which are coming in? और खास करके urban areas में आज की डेट में जीन टेस्टिंग और जीनोम टेस्टिंग चल रही है, तो इनके बारे में अगर आप हमारी ऑडियंस को थोड़ा बताएं कि ये कैसे नॉन इन्वेसिवली या क्विकली या इजीली आप अपनी स्क्रीनिंग करवा सकते हैं, तो व्हाट आर दोस टेक्निक्स एंड द बेनिफिट्स ऑफ दोस?
वी नो दैट हमारे शरीर में बहुत सारे ऑर्गन्स हैं, हर ऑर्गन को कैंसर हो सकती है. एंड इट्स इम्पोर्टेंट टू अंडरस्टैंड कि हर ऑर्गन की कैंसर का स्क्रीनिंग मेथड अलग है. कुछ कुछ कैंसर्स को हमको स्क्रीनिंग मेथड अभी तक नहीं है. कुछ कैंसर्स का स्क्रीनिंग मेथड बहुत रोबस्ट है. जैसे बहुत छोटे छोटे ब्रेस्ट कैंसर्स को भी हम लोगों ने वी कैन आइडेंटिफाई यूजिंग MRI breast or using certain 3D mammography tests like 3 millimeter or pre-cancer changes we can identify. But certain cancers we cannot identify. But there it's एक सिंगल टेस्ट नहीं है जिससे सारे कैंसर्स को डिटेक्ट कर सके. ऐसा नहीं होता है. हर एक ऑर्गन की कैंसर की स्क्रीनिंग अलग होती है. देयर आर सो मेनी एडवांसेस इन ईच पर्टिकुलर ऑर्गन, right? Like for example, we don't have certain robust methods for ovarian malignancies. Ovarian cancer को indirectly CA-125 blood test रेज होने के पहले डिटेक्ट, मतलब ओनली इट इज एट सर्टेन लेवल वी कैन डिटेक्ट इट. ओवेरियन कैंसर ऐसा कैंसर है जो ऑलरेडी इसका स्प्रेड होने का चांस ज्यादा रहता है, क्यों चांसेस कम हो जाते हैं. तो उसको पहले से टेस्ट करने का रोबस्ट मेथड अभी तक कोई नहीं है. स्कैन करके ब्लड टेस्ट करके ओनली वी कैन डिटेक्ट आफ्टर वी कैन सी इट और आफ्टर इट रेज सर्टेन लेवल ऑफ ट्यूमर मार्कर्स. ठीक है. एंड आजकल ब्रेस्ट का मैंने अभी बताया. And then there are prostate where we use prostate specific antigen. For colon cancers, there are some, of course, blood tests which are more prognostic. मतलब अगर already cancer हो तो उसको prognosis करने के लिए help करता है. But screening के लिए अगर आपको तो इसका method invasive होता है. There are non-invasive methods like the CT scanning or other scans, but the invasive methods like scopy, colonoscopy or sigmoidoscopy, these are invasive. We have to put in a tube और अंदर देखा जाता है. तो हर कैंसर का अलग अलग टाइप तरीके के स्क्रीनिंग है, स्क्रीनिंग टेस्ट हैं. एंड some screening tests are they're impractical to do in everyone. तो इसीलिए जो कैंसर स्क्रीनिंग की टेस्ट किसी को एडवाइस करने से पहले तो प्रैक्टिकलिटी देखना जरूरी है. सो अगर किसी को कोई हाई रिस्क ही नहीं है, just but they want to know if they have colon cancer or not, it's pointless to keep subjecting them to colonoscopy. It's an invasive test because it itself has some complications. Right. Scopy करते समय sometimes during the procedure there can be some complications, though they are very rare, right? So we have to be very careful. And there's something called as liquid biopsy, or there are now tests that people often hear about, that you can detect cancers in your blood. It's called as liquid biopsy. So in a 5 ml of blood sample, you can detect cancer cells or the DNA of cancer cells. But this particular test is not still perfectly established. It's still in the nascent stages. अगर ऑलरेडी किसी को कैंसर हो, उनका ट्रीटमेंट खत्म होने के बाद अगर कैंसर वापस आने का या कैंसर कहीं फिर से शुरुआत हुआ कि नहीं है, so ऐसा जानने के लिए we can use that test as of today to certain extent. Even that is not robustly established, but the liquid biopsy, taking a blood sample and detecting cancer, by that method is still not robust. And talking about gene mapping, genetic tests. So हम लोगों को especially in India, the health tests, the blood tests are easily available. हमारे घर के आसपास बहुत सारे diagnostic centers होते हैं हमको like जिनके reliability, whether they are standardized or not, we have no idea. But we still go there, get the blood test done, and then try to believe those reports. That is the situation that we have in India. Having said that, there are good labs around. You should look for NABL accredited labs. So then we get good reports from such labs. Now, it is very different undergoing blood tests for, say, your cholesterol, for your sugar, versus you undergoing genetic testing for cancer screening, right? So there is something called as pre-test counseling, genetic testing, and post-test counseling. Right. हम एयरपोर्ट में बाहर निकलते हैं, हैदराबाद एयरपोर्ट में मैप माय जीनोम करके एक एड पड़ी होती है. It is very dangerous to get your genome mapped. It's like you knowing your life history, you knowing your astrology, your genetic astrology, without knowing what to do about it. Because we only know certain genes जिसकी identification से हमको क्या नुकसान है, क्या फायदा है, हमको that information we know only for few genes. it is definitely helpful for certain people. That is what one needs to understand before undergoing genetic testing. Please don't go and give your sample for ऐसे ही randomly knowing your genes. You may be told that you have some 1,000 defects, और आपका you're now totally anxious कि this is wrong, that is wrong, और आप उसके बारे में बैठ के गूगल में पढ़ रहे हो, जो जेनेसिस को भी नहीं पता हो उससे क्या करना है. Or
Right.
there may be maybe your psyche is changed for life. Suppose you have BRCA mutation. Now, without undergoing proper counseling, yes, you will know what it is. But without undergoing proper counseling, if you go for the test, and if you know you have the test, the kind of trauma that you have thinking about yourself and maybe your children later is immeasurable. अगर आपने पहले counseling लिया हो, तो then you know what to expect. There is a way to tell the risk everything. ठीक है? So it's very important to selectively undergo genetic testing and clearly in the purview of a trained practitioner. Otherwise, it can cause more dangers and more quality of life impacts than we can think of.
Great, great. Thanks, Dr. Ramya. So आई थिंक जो हमारी ऑडियंस है उनके लिए जानना इम्पोर्टेंट है कि एक प्रोटोकॉल्स बने हुए हैं बाय एज एंड बाय कैंसर टाइप इन मेल्स एंड फीमेल्स, तो उसको आप फॉलो करें. देयर आर ब्लड टेस्ट विच you can use, and then there are some cancer markers which at a particular age, if you're at high risk, then based on the guidance of your doctor you can take those tests. Dr. Ramya, there is one question which has been posted कि जो CA-125 आपने बताया for ovarian cancer can detect cancer to what extent? क्या ये अर्ली स्टेज कैंसर को भी डिटेक्ट कर सकता है, और किन पेशेंट्स में, अगर आप थोड़ी सी गाइडलाइन शेयर करें तो आई थिंक this will help everyone.
So CA-125 is a routinely done marker for CA ovary, but as I was telling, so there is no guideline for screening of ovarian cancer as such. So who should undergo and at what age? So of course there are some hereditary breast ovarian cancer syndromes. Syndromes meaning BRCA, as I was just telling, the gene BRCA1 and 2. These are at high risk for both breast and ovarian cancers because of genetic mutation. So इनके लिए guidelines पड़े हुए हैं, but not for routine population, because as such the incidence मतलब कितने नया cases आ रहे हैं, ओवेरियन कैंसर के उतने कॉमन नहीं हैं जितने ब्रेस्ट के हों. ठीक है? तो there are some guidelines for group of population, but not for the entire population. If we take CA ovary, so that's what I'm highlighting. So it's different for each different and depending upon your risk factors, right? So other thing is it doesn't detect in very early stages that you can benefit by completely preventing its spread. So here I want to say that I am an expert in breast and endocrine. Like endocrine means thyroid and parathyroid cancers. So my other gynae oncology colleagues will be the right people to talk about this in detail. But having said that, I'm aware that CA-125 is not a very robust screening method, nor the ultrasound that or CT that we can, because we need to see physically a structure on imaging for it to be able to be detected. Here, if we are screening, we should talk about very early screening. For example, in breast, we can detect even the precancerous calcifications, even before it becomes a cancer, right? That level of screening is still not possible in ovary.
Okay,
that's
great.
what I can say.
Thanks. Yeah, Pratik.
So, Doctor, I have a few questions as well. Right, you touched upon relapse, right? Cancer relapse. तो कितने साल बाद यूजुअली माना जाता है कि रिलैप्स होता है, और शायद कुछ कैंसर होते हैं कि जैसे ब्रेस्ट कैंसर हुआ है, उसके बाद कोई और कैंसर होता है 8-10 साल बाद, तो वो रिलैप्स में आता है कि नहीं आता, और इज इट अ न्यू बिगिनिंग ऑल टुगेदर? How do common men see it?
So it is possible for cancer to come back after many years. तो कैंसर सेल्स डॉर्मेंट होके हमारे इम्यून सिस्टम से बच के कहीं छुपे रहते हैं बॉडी में. तो they become dormant. They don't actively cause any damage. They don't get noticed by our immune system. तो जब कभी मौका मिले इन द फ्यूचर, जब बॉडी की इम्यूनिटी कम हो गए हो, health, general overall health kharab then they start getting activated when they identify good fertile ground for them to grow. It is possible. So and अलग अलग cancers अलग अलग type पे recur कर सकते हैं. So I can talk about breast. There are some subtypes of breast cancer. कुछ breast cancers होते हैं जो 10-20 साल के बाद भी वापस आ सकते हैं, especially hormone positive tumors, because when we are suppressing it with medications to suppress hormones, they get suppressed, they don't die. Once after many years, as I said, when there are conditions that are fertile for them, they start growing, right? So certain ERPR negative breast cancers, they come back within 5 years. They're very aggressive. तो अगर किसी को ब्रेस्ट कैंसर वापस आया हो तो वी लुक एट कहाँ वापस आया हुआ है. अगर दूसरे ब्रेस्ट में आई हो, 2 साल के पहले आई हो, तो वो प्राइमरी कैंसर का रिकरेंस माना जाता है. अगर 2 साल के बाद आई है दूसरे ब्रेस्ट में, देन इट्स अ न्यू कैंसर, राइट? और इफ इट कम्स बैक एल्सवेयर, ब्रेस्ट कैंसर की सेल्स हमको बोन्स में पाया जाता है. Obviously, it is the primary cancer cell that has remained dormant. Now it has become active. ऐसे हम उसको understand. That's how we can understand it.
Great. Thanks, Dr. Ramya. So, Dr. Ramya, just to summarize this part, कि जो screening है, वो एक basic screening आप करवाएं. हमने शुरू किया कि in certain areas, regions of India, you should specifically get screening for. Then we moved on to that, if you have some history, then you should prioritize. Then we moved to there are some new ways in which we can detect cancer. Or gene testing bhi only under the guidance of your consulting doctor at a reputed lab you should take. Right?
Yes.
So I think these things are very
So
important.
your personal risk,
And
your
vaccination-
family risk, your personal risk, your family risk, your region risk. So there are multiple factors that influence.
Right. No, very nicely put, Dr. Ramya. And then we talked about vaccination. Vaccination guidelines हमने बताई कि essentially for girls in the age group of 9 to 15, it is advisable, right? And that is where we should see that they are able to get this vaccination, and boys also, because even though the type of cancers which are prevented, their incidence is low, but still, it is prevented, right? So it is better. Dr. Ramya, I think we are at time, right? And what we would suggest, the final points to be made around that, some people have this myth that their insurance policy may not cover cancer screening. So please reach out to us. Please reach out to Insure Joy. Please reach out to, your policy, customer support, because there are policies which you can take, which do cover cancer screening as well, right? So that's important for all of us to understand कि कैंसर, जैसे आपने बताया डॉक्टर रमया, कि the incidence is increasing, ये तादाद में बढ़ रहा है, और स्क्रीनिंग इज वन ऑफ द मोस्ट इफेक्टिव वेज कि हम इसको अर्ली डिटेक्ट कर सकते हैं, तो इसका इफेक्ट कम होगा. और इसके साथ अगर हमारी पॉलिसी, इंश्योरेंस पॉलिसी हम ऐसी लेते हैं जो कि इनको कवर करे स्क्रीनिंग्स को, आई थिंक ये सबके लिए फायदेमंद है. तो आई थिंक that's what I would like to conclude with. Dr. Ramya, any concluding remarks from your side?
So I would like to say that yes, then it is real that cancer numbers are increasing. It's not a disease of the West, and many cancers that we are seeing are lifestyle dependent. So it is important to have a healthy lifestyle, active lifestyle, consume less processed food, and don't be sedentary. Don't keep stuck to your screens, and I think go back to your traditions, because back then they were healthy. And yes, don't ignore your health. You may be, however, if you don't take care of your health today, you will be forced to take care of your disease tomorrow. So please take your health into your hands, because health is wealth. And yes, it is very, it makes sense to have insurance policies which offer cancer screening, right? So we don't want to get treated for a disease. We want to identify it as early as possible if we are at risk or not. So it's important to be aware, especially for growing numbers of the cancer that I just mentioned. So please take care of your health actively.
So one
Thank you.
last question from
Yeah.
me as well, Rahul. So
Yeah,
Dr. Ramya, जब हम स्क्रीनिंग की बात कर रहे हैं, तो just in numbers, are there any statistics to say कि अगर लोग स्क्रीनिंग कराते हैं, so what are the chances, the risk that comes down with screening? तो हम इसको avoid कर सकते हैं if we do regular screenings.
Screening doesn't prevent cancer. Screening identifies cancer early. So अगर हम 10,000 mammographies करते हैं, उनमें से we can detect 860 to 900, I mean 860 to 1,200 breast cancers ahead of time. Right? So that much burden, that much mortality, so that much death rates come down. Right? So it is huge number. Matlab agar 1 in 10 you are able to detect by using mammography. Especially this is the data from West, where the risk of breast cancer is 1 in 4 to 8. हर 4 महिलाओं में एक को breast cancer हो रही है. ये मैं नहीं कह रही हूँ. Globocon data बोल रही है. India में the risk of breast cancer is 1 in 24, 1 in 20 to 24. Even here it is very high. So definitely ahead of time, we are not preventing cancer by doing screening. We are identifying it early. We are preventing cancers by taking vaccines, by following good lifestyle. We are identifying them early by doing screening. So उससे क्या होता है कि ट्रीटमेंट कॉस्ट, लॉस ऑफ ऑर्गन, अगर हम ब्रेस्ट कैंसर को बहुत छोटे में आइडेंटिफाई करते हैं, केवल सर्जरी और हल्का सा रेडिएशन की जरूरत पड़ती है. If we identify that in a huge advanced stage, फिर कीमो रहेगा, रेडिएशन, सर्जरी, everything. And the cost, the loss of quality of life, the loss of paid days, and the financial burden, on psychological burden, loss of organ, breast removal, all these things can happen. And of course, death. All these can be prevented if we identify it early by screening.
Got it. Yeah,
great. Thank you. So, I'll just briefly thank Dr. Ramya, Pratik, and then you can sum up. So, Dr. Ramya, thanks a lot. I think very insightful. It's a very vast topic, but I think we were able to get some nuggets of key guidelines जिससे सबका फायदा होगा. तो बहुत बहुत शुक्रिया आपका ये सिंपल लैंग्वेज में सबको समझाने के लिए. जितनी भी ऑडियंस हमारे साथ गूगल मीट पे जुड़ी या हमारे यूट्यूब चैनल पे जिन्होंने इस सेशन को देखा है, सो थैंक्स अ लॉट फॉर टेकिंग द टाइम आउट. Pratik, over to you.
No. Rahul, you summed it up, but yeah, Dr. Ramya, thank you so much for taking out time on a Sunday.
Thank you very much.
Small things I'm sure will go a long way for people to understand how important lifestyle changes are. Go back to your roots. जैसे थे वैसे अच्छे थे. I don't think modernization takes us anywhere, right? And you very nicely put it. I think very, very informative session. So guys, I think we'll meet next month, third Sunday, that is 16th March, with another very important topic. But Dr. Ramya, again, from the bottom of our heart, thank you.
Thank you very much for this opportunity.
Yeah. Thank you, Ramya. And Dr. Ramya, and thanks, Kims, as well. So thank you, everyone. Thank you for everyone. Yeah, thank you.